Healthcare reform may bring more medical care services to Americans, but with it is going to bring more complexities to the nation's physicians. So are doctors prepared to be the business people they need to be for their patients? You're listening to ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and joining me today is Dr. Wright Pinson. Dr. Pinson is the Deputy Vice Chancellor for Health Affairs and the CEO of the Hospitals and Clinics at Vanderbilt University Medical Center. Dr. Pinson has held a variety of administrative and research positions at Vanderbilt for more than a decade and remains an active clinical researcher in the field of transplantation surgery, having received numerous grants. He has authored more than 250 contributions to the literature and given more than 500 scientific presentations and lectures. We're so happy to have Dr. Pinson on the program. He joins us today from his offices at Vanderbilt in Nashville, Tennessee. Dr. Pinson, welcome to ReachMD Radio on XM 160, the channel for medical professionals.
Well, thanks so much for having me. I appreciate the opportunity.
Well, it's very interesting to me. Like when I started as a healthcare business reporter about 16, 17 years ago, that was a new phenomenon. And what I always knew about Nashville is that it was a home of entrepreneurial healthcare business ventures. But you often wondered, with the physician having such a large role, are physicians really prepared as business people? And you're going to tell us a little bit about this interesting program they've got going at Vanderbilt in the Owen School of Management, and I'll let you just take it away, Doctor. Tell us about this.
Well, let me start by saying I think that there is a growing cadre of physicians who are making themselves adequately prepared to contribute to administration of healthcare. What I mean by that is there's no question there are a number who are getting additional training in business, usually at the master's level in one degree program or another. We have developed a program here at the Owen School of Business that does make it easier for young physicians in training, namely our medical students, to combine their MD degree with an MBA. We also run a healthcare MBA independent of that, and that turns out to be the largest and most popular program at our graduate school of business, in part because, as you mentioned a minute ago, Nashville is a very entrepreneurial community in healthcare. A third program that we have developed is a master's in management of healthcare, where we are training people who work here at the medical center, some of which are physicians, roughly a third, some of which are nurse managers, roughly a third, and others come from all kinds of different support departments, roughly a third. That latter program has gotten some notoriety recently. It's a one-year program designed to take physicians and these other groups that I just mentioned up a significant notch in their sophistication in managing healthcare on the provider side, meaning an institution like our medical center here at Vanderbilt.
And so that program, the one-year program, you would get an MBA, as it were, or is it just a master's, an advanced degree?
It's called a Master's in Management in Healthcare, and the difference between it and an MBA is it is almost entirely focused on healthcare. So that if you wanted to be a consultant or you wanted to be available to handle almost any business matter, then we would still encourage people to get an MBA. On the other hand, if you're already rooted in healthcare delivery or some other aspect of healthcare and you know that's where you're going to want to stay, then we recommend this Master's in Management in Healthcare. It's a shorter program and gives these individuals who want to increase their capabilities the opportunity to do so in a relatively cost-effective way.
Well, so tell us then about the popularity of this, because I just sort of envision, physicians, certainly they like doing what they're doing, but you come to a point where, maybe you want a career change, you see the potential for millions of Americans to get healthcare coverage, more money coming into the system, and you want to do something else and you want to be prepared to be maybe your own boss. How popular is the program? How is enrollment?
We started the program 2 years ago, and in the first year, we had 25 students enrolled in the program. And then in the second year, we had now 30 students enrolled in the program. And so we've had no problem at all finding interested students. And as I mentioned, this is just one of a couple of the programs in the Graduate School of Business. The MBA programs, attract yet another cadre. And those programs have been very popular amongst physicians, I think, let's say increasingly over the last 10 or 15 years.
And at Vanderbilt, as we know, has got a wonderful reputation across the country. Are you getting most of your students from the Nashville area, or are you starting to gain traction across the country?
Well, it's different for the different programs. The Masters in Management and Healthcare, we have been starting out by trying to develop this for people who have worked in the Nashville metropolitan area. Starting out mostly with our own institution, but in the past year, 50% of the students have come from other institutions around the so-called Middle Tennessee area. Now, the MBA program is very different. In that program, we are attracting students from all over the country.
Tell me, if you could, having been a physician who came up through the clinical and research side, I'm sure a lot of this stuff wasn't around when you were in medical school. What would you say that the benefit would be of physicians and in training this? And also, what was your experience like? Was it just learning on the job? I mean, what would a physician benefit? What kind of courses should they be looking for?
Well, I have to confess that my own background is a little out of the ordinary in the sense that I started out as a physicist working for IBM, and they encouraged their young engineers to get business training. So I got an MBA before I went to medical school.
That is unusual.
So there's no question that in my career, that background, that knowledge helped me be more effective in establishing clinical programs and all of the management that went with it and all of the budgeting that went with it. And I also would say there's no question that it accelerated my own shift into management over the course of my career. Having said that, I think that today's healthcare organizations are more and more demanding managers who have the confidence and the expertise and the skills to build and manage people and programs and organizational initiatives. And so those physicians who choose to engage in some sort of formal educational process, I think, provide themselves with the skills that they need to be successful. In general, there is an increasing awareness of the value of this more formal education. Prior to, let's say, the last couple of decades, I think most people thought you could manage in any business, and especially smart people like physicians thought you could pretty much do this by the seat of your pants. The fact of the matter is there is a whole body of knowledge out there, and that it needs to be assimilated and worked with, just like the body of knowledge that you need to have as a physician to do your work in that area. So the ability or the willingness of people to dig into that additional body of knowledge and become more expert as administrators and strategists is the key here. That's what has added the value.
Well, if you're just joining us, or even if you're new to our channel, you're listening to ReachMD Radio on XM 160, the channel for medical professionals. I'm Bruce Japsen, your host, and joining me today is Dr. Wright Pinson, who is the CEO of the hospitals and clinics at Vanderbilt University Medical Center. And we're talking about increasingly a lot of schools are getting into business courses for physicians, if you will, and at Vanderbilt, they have some extensive programs for healthcare professionals to become better business people. And Dr. Pinson, if you will, this is probably a good thing. Tell us how it's integrated into the medical school so a physician, as they go through medical school and their training, they can take these courses. Is that what we're getting at Vanderbilt?
Well, not only can medical students take some of these training courses, But some of our staff physicians, as I've mentioned, who are already in administrative roles at this medical center, or they are younger physicians who have expressed interest and we are grooming them to come along to potentially take administrative roles, have gotten involved in some of the programs. And the advantages here are that the programs do include other individuals besides physicians, and we think that all training together is of value. We also think that it's in conjunction with needs at the medical center and closely wrapped into the medical center, meaning we have projects that they perform that are totally insinuated with work we need done at the medical center, has provided a quality educational experience that I think is very practical and goes beyond what one can usually get in the classroom.
And the interesting statistics your office sent, they talked about how the Master's in Management and Healthcare began with 25 students and enrollment is up 30 to 40%. But Vanderbilt also has the largest healthcare MBA class in history. When students contact you or people want to do this, they're probably realizing that the healthcare economy is one, if not the only one, that is continuing to grow and will continue to grow.
Well, I think that's right, and you'd have to be asleep right now not to recognize that there is a strong call nationally to improve healthcare management. And I think these kinds of programs provide the practical bridge in the gap that we have. There's no question that today's healthcare organizations need better managers. I think this emphasis right now is very timely and, meets some of the demands that society has for us in the healthcare field.
For our physician listeners out there or any other folks that are considering advanced degrees in healthcare, getting in the healthcare field, give me an example of the kinds of courses that they might take in their first year, or if they were, let's say they were a nurse manager and they wanted to advance themselves.
Well, we think of our courses as being core courses that would be drawn from pretty much any Master of Business Administration curriculum, and then we also have healthcare industry-specific offerings. So first, let's talk about the Common Core, which includes microeconomics, accounting, finance, marketing, operations, human and organizational performance. The healthcare industry-specific courses, secondly, would be kind of a overview of the healthcare landscape. It would dig into accounting and finance for healthcare managers, the economics of healthcare delivery and finance. It would focus on strategic marketing of healthcare service, configuring and optimizing healthcare operations, and then I would say just generally strategies for high-performance healthcare organizations.
And are these courses and degrees, and are they starting to prop up in other business schools across the country? Are you seeing more and more of this?
Oh my, there are numerous business-oriented master's degrees offered at many institutions. There's a whole range that are available, and yes, there are many, many of them available.
And is healthcare, would you say, is that the top area of where the entrepreneurial curriculum is going as far as the growing programs? I mean, you would think that if I'm running a business school, if I didn't have a healthcare program or at least thinking about expanding one, then I might have a problem on my hands.
Well, I think there's no question that this has been popular. I guess I'm not in a position to say whether it has been as popular elsewhere as it has been here at Vanderbilt, but I think you're right. There's generally an increasing sense of need in this area.
Well, with that, I'd like to thank Dr. Wright Pinson, who has been our guest. We have been talking about healthcare education and business in particular for physicians. Others have a very fertile area for growth. And at Vanderbilt University, where Dr. Pinson is, it is a healthcare entrepreneurial mecca, if you will, for education, and they've been addressing these needs. I'm Bruce Japsen of the Chicago Tribune. I've been your host, and you've been listening to ReachMD Radio on XM 160, the channel for medical professionals. ReachMD online on demand and on the air, please visit us at reachmd.com. And I'd like to thank you today for listening.